The UCL Institute of Healthcare Engineering Summer Studentship has been running since 2021. It's an opportunity for students to do a research project based in a clinical hospital department. It's an exciting chance for them to see how real-world engineering can be applied in healthcare, but also it actually provides a good opportunity for our research teams to make use of some of our best students that study here in UCL.
I'm Dr. Peter Snow. I'm a lecturer here at UCL and I work in the Institute of Orthopaedics and Musculoskeletal Science. So we have a team here based at the hospital, at the Royal National Orthopaedic Hospital, and we do a range of research including virtual reality and robotics for rehabilitation following an amputation or a spinal cord injury. We also look at projects and research for surgical and medical simulation, so using virtuality and robotics to train surgeons and also clinicians on how to do procedures. I've been involved in the IHE Summer Studentships from the very beginning, but in recent years I've been the primary supervisor for a number of students.
Yeah, so I'm Shreyas Dalke. I'm a third year medical sciences and engineering student, and I'm currently doing the IHE Studentship Scheme. So my department, the Division of Surgery and Interventional Sciences, they actually sent an email, and obviously I checked my email, so I had a look at it and I was like, wow, this seems kind of interesting. You know, my interest of going to the healthcare engineering, so I was like, yeah, let's give it a shot. And yeah, I saw a project with Peter that I've worked with before, and I was like, let's go for it.
So Shreyas is a very good student. He has been for a long time, and he's actually now doing his master's degree at UCL. So Shreyas has got a good background in software and hardware, and this enables him to actually really achieve on the actual project.
I'm a professor of biomechanics at UCL Mechanical Engineering Department. So this is quite an amazing thing about UCL. I got an email almost like randomly out of the blue from Moorfield Eye Hospital, say they want to do research on this topic, and then they wanted to work with engineers. And then conveniently or coincidentally, this scheme came up, and then we said, okay, why don't we take advantage of this? And then these two brilliant students came up.
So I'm Charlotte. I'm a second year student doing biomedical engineering.
Hi, my name is Rosen. I recently graduated from the medical physics undergraduate course.
So I heard about the scheme during my first year from my transition mentor, and I was immediately excited because I know it will be such a good opportunity to collab with clinicians, engineers, and other people in the field. But at that time, I think the scheme only opened to second year and above, so I waited another year. So as soon as I moved into the second year and the application is open, I applied for it.
I heard about this scheme on the UCL website when I saw blogs from previous students who had done the internship. I found it interesting how the students got to have experience in hospitals, which was quite different to previous projects I'd done that were mostly, completely computer-based.
Hi, my name is Camilla and I'm a student of Medical Sciences and Engineering. I heard about this scheme from my department, so I got an email from them and they gave me a bunch of projects to choose from, and I just picked the ones that I thought were most interesting to me.
Students will take research projects in these clinical departments. They'll get opportunities to see healthcare equipment in use and make improvements on it. They'll get opportunities to see patients and see how their problems are solved by engineering in these environments.
Highlights, obviously, without a shadow of a doubt, like working with virtual reality, all the robots. I mean, in quite plain terms, it's cool, just working with the things. Yeah, the experience has been great, you know, creating these simulations in different environments and seeing how they can actually be applied for, obviously for clinicians, for patients, and for future work. So
the work that Shreyas is actually building on is the work that a former colleague here at the hospital and at the team, Tiana, she was working on using like a robot to help spasticity, So this is a robot that she created as part of her PhD, and it's quite a large, expensive system. So one of the aims is to actually produce a more lower cost version that we can deploy not only here in the hospital but actually elsewhere as well. So spasticity is a condition usually post spinal cord injury that prevents you from taking part in rehabilitation. This is because the muscles become very, very tense, and then this enables you not to be able to perform movement actions. So what the initial work that Tiana did was to vibrate the muscles that were affected by the spasticity to make them flaccid. And she produced a robot which actually helped you actually move your arm and got really brilliant results. So it's a very common issue, but it's an issue that is preventing lots of people from actually taking part in rehabilitation and improving.
So basically we're building a biomechanical model for the low pressure eye. So a bit of the background is it's called hypertonic eye, which is caused by a certain disease like inflammation in the eye or uveitis or other surgical things, and the eye shrinked because of low pressure. And one of the treatment is you do an intravitreal injection into the eye to improve the pressure. But the problem is the clinicians are unclear about how different structure in the eye expand due to that injection, and they saw some side effect on some patients, and they want to get a bit more insight, understanding about the process.
So understanding more about the mechanism of this intravitreal injection treatment can help to understand more about how it impacts vision, or how it could potentially have side effects like retina or optic nerve damage, which would help validate the procedure and have it help more patients. We developed a computational model using finite element modeling in a software called ANSYS. So that was used to simulate low pressure and how the eye shrinks, as well as the injections for treatment, to see how that then deforms the eye and whether it brings it back to its original shape.
It's always amazing to see passionate students because, for example, I got the emails from these two students, and then I could sense they are genuinely interested, and then also I think they did some good homework already. So I immediately thought, okay, these guys are seriously interested and I wanted to work with you, work with them.
My research currently focuses on creating diagnosis embeddings for patients which accurately reflect their health status. So embeddings are essentially representations of different concepts such as diseases, and we can use them to help predict what the patient's future might look like, and we can give them to clinicians to help them generate insights. I think this research has been extremely valuable. I have learned a lot about this field that I'm very interested in, which is machine learning and AI, which I think will be very important in the future of healthcare.
Our clinical researchers have also gained massively from these projects because they get access to an elite engineering student based here at UCL for 8 weeks doing a project, which is equivalent to an undergraduate research project, completely focused on it and some of our best. And many of our students then get to share their research at the end of the projects through academic papers and research conferences. So we're very used to our students producing real benefits to our researchers and getting questions answered that they want answered. So it's a two-way process, benefits students and for researchers.
I think the IHE Summer Studentship is a really good scheme. It pairs you with students who really need the experience. It also allows you to have clinical exposure because you're working with a clinician as well, and the student also gets to have exposure of the clinical impact of their work.
Our clinical collaborators currently are based in 4 hospitals, at the Royal National Orthopaedic Hospital, at UCL Hospital, also at Moorfields Eye Hospital and Great Ormond Street Hospital. Generally, around the start of the year, January, we will send out a call for projects to ask clinical researchers if they'd be interested in one of our engineering students for 8 weeks. And then in March, the application process for students opens to allow them to apply as well. And then with students appointed to projects in April, May, and then starting their projects usually in June once their undergraduate exams are finished. We do encourage students from all backgrounds to apply. Whilst you're taking your 8-week studentship, you're fully funded, so you get all your living expenses paid for you, allowing you the full freedom to focus on the research. So when students apply for our projects, they get to look at a list of usually 10 to 15 project proposals at various hospitals. They get to see what the project's about and who exactly they'll be working with. And then they can choose one or two of those projects that they think they're best suited to, and they make an application based on that, and sharing their CVs and their own backgrounds, but also choosing the project that they feel most interested in or they're most suited to. Look out for applications and projects with us at the IHE next year.